All new at 10, the critical need for organ donors. The latest numbers show 17 people die every day waiting for an organ transplant. And like the national demographics, the list of people in need of an organ is diverse. It spans age, ethnicity, and gender.
Fox County's Arthur Mondale reports on the need for more donor diversity and an advocate working to get herself and others off waiting lists.
At one point, I had to decide to take control of my life and my medical condition.
We're in the kitchen with Katrina Mattison, a 40-something who lost over 130 pounds after working out 5 days a week and switching to a plant-based diet.
Had its share of ups and downs.
She's a type 1 diabetic who's been fighting to survive since age 15.
So I was sticking my fingers 8 times a day and doing 4 to 5 insulin shots a day.
A teenager with a high risk for kidney failure, heart disease, and stroke.
I kind of have what they call a double whammy because I am a type 1 diabetic and I also suffer from hypertension. I've been hypertensive since 17.
She worked closely with her doctors, but at age 28, the young professional got another devastating blow.
I was in stage 5 end-stage renal disease.
Her kidneys were close to failing. And even after getting a new kidney in 2015, the spiral didn't stop.
My body rejected that organ, depending on the age of the donor, depending on physical activity of the donor, just different aspects are taken into consideration as far as how long they anticipate that organ to last.
But don't call Katrina a survivor. She's a thriver.
I may have kidney failure, but kidney failure does not have me. And it's the same with diabetes. I may have diabetes, but diabetes does not have me.
She's still working closely with her doctors, doing in-home dialysis, and using her social media to advocate and find donors for young adults and youth with backstories like hers.
With this horrible disease, we do not fight alone. We have to band together and be an advocate and a voice for each other at all times.
It's critical.
Dr. Monica Walker is a physician with the T. Leroy Jefferson Medical Society. She believes the medical community can't be persistent about organ donations solo.
We want people to be aware that they can donate organs, that they will not have their life shortened if they have a donor card in their wallet. We will not shortchange them any opportunity for an emergency department visit or an ICU visit or extended ICU to try and just get their organs. And I know that that's been a discussion before. I might die prematurely because they're trying to get my kidneys, or they're trying to get my pancreas, or they're trying to get my lungs, or they're trying to get my liver.
Dr. Walker also points out while ethnicity is not a requirement for a match, a diverse registry gives more people a wider candidate net. Every 10 minutes, a person is added to the transplant waiting list. And this chart from the Health Resources and Services Administration shows kidneys remain the most in-demand organ.
The medical community would be happy to have them and walk them through that process.
Back home with Katrina, she's still patiently waiting for her own candidate to come forward with a kidney and a pancreas.
Everyone deserves that chance to live and receive that organ donation that will possibly save their lives.
Arthur Mondale, Fox Carolina News.